Hi, I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors, and we often say in the office, Medicare is the air we breathe. It's our thing, it's what we do every day, and I wanted to do just a quick video to talk about the Medicare Supplement Plan N. It's picking up in popularity, and just explain how does it fit with Medicare, what does it cover, what gaps does it cover. But before we get into the Plan N, I want to back up and just talk about original Medicare just for a brief moment. What's Part A of Medicare, what's Part B of Medicare, and what do they cover, and what gaps are there with original Medicare. So Part A of Medicare is your hospitalization, whereas Part B of Medicare is everything outside the hospital: primary care, doctor, specialists, emergency rooms, outpatient procedures, even so on and so forth. Part A of Medicare, often people say it's free. Well, it absolutely was not free. All these years you've been working and they're pulling money out of your paycheck for taxes. The portion of your taxes that went to Medicare paid for Part A. So you've already paid for it. It's already been paid for. So when you turn 65, you're entitled to Part A of Medicare. You can sign up for it, and it's already been paid for. So it absolutely was not free. You absolutely paid for it, but there's no premium going forward. What does Part A cover? What does it not cover? So day one, you're admitted to a hospital. Under Part A of Medicare, you have a deductible of $1,632. That will cover you for up to 60 days. Now, the catch with this deductible is it's not annual. So if you're admitted to a hospital, you pay that $1,632, and you're there for a few days, you go home, and a few months later, you're back in the hospital. Well, you're going to pay this again. So you could pay that deductible several times in a year if it's a rough year health-wise for you. If you're in the hospital for over 60 days, you have a per-day copay of $408. You're paying that each day you're in there. And if you're in there for over 90 days, well, now that per-day copay doubles to $816. Skilled nursing is also covered under Part A of Medicare. Skilled nursing is basically a place to recover. So if you've had a life event, a heart attack, a stroke, or let's say you have a hip replacement and your doctor says you're stable, but you're not quite ready to go home yet, oftentimes they're going to move you to a skilled nursing facility basically to recover. So this is where you're going to have your physical therapy, speech therapy, occupational therapy, things like that. You'll have registered nurses taking care of you until you're ready to go home. Medicare fits the bill for the first 20 days. So you pay nothing for the first 20 days under Part A of Medicare. After 20 days, well, now you have a per day copay each day you're in that skilled nursing facility of $204 that you're paying each day up to 100 days. So that's what your exposure looks like under Part A of Medicare. Now, Part B of Medicare comes at a premium of $174.70 a month. This is the standard Part B premium in 2024. This can go up based on income, and for more information on that, check out our video on IRMA, income related monthly adjustment amount, but most people are going to be paying $174.70 for Part B. With Part B of Medicare, it's everything outside the hospital. It has its own deductible of $240. This is different from your hospital deductible in that it's annual. So you're just paying this one time a year. Once you've paid that $240, well, now Medicare is going to kick in. They're going to pay 80% and you're paying 20%. So anytime you see a healthcare professional, primary care, doctor, specialist, emergency room, outpatient procedures, so on and so forth, you're paying 20%. The big issue with this is you have no max out of pocket. There's no ceiling to what you could end up having to pay. This is why people get a Medicare Supplement Plan. They're also called Medigap policies to fill these gaps of Medicare. So that's where we're going to bring in a Plan N. If you combine a Plan N with Medicare, what's your exposure? What's your cost to look like? So with a Plan N, if you end up hospitalized, day one you're admitted to a hospital, this deductible, the $1,632, is paid for you every time. If you're in there over 60 days, that per day copay is covered every time. If you're in there over 90 days, that $816, that's covered every time. The skilled nursing copay, it's covered. So when you combine a Plan N with Medicare, you have no network. Any healthcare provider in the United States that takes Medicare will also take this Plan N, and all you're going to receive in the mail is a statement of benefits paid, because Plan N is going to pick up right where Medicare left off. It's dynamite coverage. It really is. So how does a Plan N work with Part B of Medicare, everything outside the hospital? So with Part B of Medicare, you still pay this deductible with a Plan N. But remember, it's an annual deductible. You're paying that $240 deductible one time a year. Once that's been paid, well, now Medicare's kicking in. They're going to pay 80%. And if you go see a primary care doctor or a specialist, you're going to have a copay with this Plan N. The copay can't be higher than $20. If you end up in the emergency room, the highest the copay could be is $50. But with your primary care doctor, your specialist, Oftentimes these copays maybe are $12 or $15, but the most they can be is $20. So you have copays with the Plan N that you don't have with other supplemental plans like a Plan G. Now, a benefit of a Plan N is you get a lower premium. So you can often save somewhere between $350 and $400 a year in premium by adding these copays and going with the Plan N. So that's a lot of savings, and it would cover, that savings in premium would cover quite a few copays at a healthcare provider. One of the things that intimidates people away from the Plan N is what's called the Part B excess charge. And so what this means is if a healthcare provider accepts Medicare, that means they're accepting the Medicare approved amount for the services they provide. Well, that healthcare provider can charge up to 15% more than what Medicare assigns them, and if they do, you have to pay the excess charge. That's the Part B excess charge. Now, if that were to happen and you have a Plan N, the Plan N does not cover that, and so you do have to pay that excess charge. So that's where people get a little bit intimidated because it's an unknown. But I can tell you that this is rare. We don't see this often. In fact, the Kaiser Family Foundation came out with a report saying 98% of the time healthcare providers accept assignment. So it's really not been much of an issue to this point with the Plan N. It's really picking up in popularity. It really is dynamite coverage and a great coverage option. If you want to see what companies offer Plan Ns in your area, what premiums they charge, call us today, 316-260-3331, and we can walk you through all the different companies available in your area, what premiums they're charging, what's the difference in cost between the companies, what's the difference in cost with the plan you already have. We can review things and shop and just see if this plan makes a lot of sense for you. I also want to mention, if you want to just see what different options there are with Medicare out there, you can call and ask for a free copy of my book, Medicare Made Simple. Health insurance is a big deal. You want to feel confident in the coverage you have. And so if you want a free copy, no obligation, we'll ship it out to you for free, no questions asked. It's going to break down Medicare, what Medicare covers, what it doesn't cover, what supplemental plans out there can you use to fill the gaps with Medicare. What is Medicare Advantage? Is it to your advantage to get a Medicare Advantage policy? And just the ins and outs of Medicare. We break it down in a way that's very simple to understand. Health insurance is important. It's a big decision, and you want to feel very confident in the decision that you're making. So we are trying to help you, walk alongside you, so you can make an informed and confident decision. So if you want to talk further about a Plan N, what options you have for a plan in your area, what companies offer it, what premiums they charge, if you want a copy of this book, or any questions you may have on Medicare, give us a call, 316-260-3331. We'd be more than happy to help. I hope you found this video helpful, and thanks for watching.